A lobotomy, also known as a leucotomy, is a neurosurgical operation that involves severing connections in the brain's prefrontal lobe. Doctors first began manipulating the brain in the late 1880s in an attempt to calm patients. Swiss physician Gottlieb Burkhardt removed parts of the cortex from the brains of patients with auditory hallucinations and other symptoms of schizophrenia, noting that it made them calmer. However, the procedure led to the death of one patient, with another committing suicide. Regardless, it's considered one of the most barbaric procedures ever used on people with mental illnesses. Unfortunately, lobotomies were widely performed for more than 2 decades as a treatment for schizophrenia, manic depression, and bipolar disorder, among other mental illnesses. This happened because when the procedure was invented, there were no beneficial ways to treat mental illness, and people were looking for pretty desperate kinds of intervention. Thankfully, with the rise of pharmacology and various medications, lobotomies are no longer a common practice. I'm Mike with List 25, and these are 25 petrifying and brutal facts about lobotomies. (25) Lobotomy means cutting a lobe of the brain. 24. Lobotomy of the frontal lobe was a very popular procedure in the early 20th century and was recommended by psychiatrists to alleviate symptoms of mental illnesses. 23. Today, it's more commonly used in North America than anywhere else on the planet. 22. According to some sources, the lobotomy was the brainchild of Friedrich Goltz, who experimented on his dogs to see what would happen. 2 years later, in 1892, Gottlieb Burkhardt used the procedure on 6 schizophrenic patients. The procedure seemed to have a calming effect on the 4 patients who survived the surgery.
Wait, hold on.
I'm guessing the other 2 were pretty calm too, because they're dead. 21. According to other sources, the concept of the lobotomy was first invented after neurologist John Fulton noticed how a chimpanzee became much calmer after surgery that destroyed the connections between the frontal lobe and areas below the cerebral hemispheres that govern the emotions. Things get calmer when you take away their emotions. 20. On November 12, 1935, a Portuguese neurosurgeon, Almeida Lima, performed the first human lobotomy using alcohol injections to destroy the brain tissue. None of this seems good. All these seem terrible. This seems like a horrible idea right off the start. 19. This procedure had been proposed by his Nobel Prize-winning colleague, Igor Maurice, as a result of a lecture he had attended given by the American neurologist John Fulton earlier that year. 18. Moniz became the first Portuguese person in history to receive a Nobel Prize for his discovery of the therapeutic value of leucotomy in certain psychoses. 17. As for the first prefrontal lobotomy in the United States, it was performed in 1936 on 63-year-old Alice Hood Hammett by doctors Walter Freeman and James Watts. They also modified Moniz's technique and introduced frontal lobotomies to America. Thanks. 16. The most common tool doctors used to perform lobotomies was an ice pick. One of Dr. Freeman's sons claimed that the first ice picks used in his father's lobotomies were from their kitchen. Dr. Freeman would hammer an ice pick into each frontal lobe through the back of the eye socket. Ouch.
No, you're not supposed to feel it.
Can I give you a lobotomy real quick so we can show them how it's done?
No.
Do you have an ice pick?
What the hell is wrong with you?
15. Freeman, who found Moniz's techniques a bit stodgy, began experimenting with an outpatient procedure where he would drive an ice pick into his patients' brains near the top of their eye sockets. Once the pick was inside the brain, he would literally wiggle it around, cutting through the white and gray matter. It was not a precise surgery, as you can tell. Oh boy. Using a hammer and his pick, he boasted that he could do a lobotomy in 10 minutes and didn't even need anesthesia. The ice pick method was too much for Watts, who distanced himself from his former partner. 14. Dr. Freeman strongly believed that if he could sever the nerve strands that connected the frontal lobe to the thalamus, he would be able to help patients who displayed signs of mental illness. Although he spent endless hours performing brain dissections of mentally ill patients, he never found any difference between their brains and the brains of mentally healthy patients. Because they all had ice picks through them.
13.
Walter Freeman performed 3,500 lobotomies in 23 states during his career, although many were not successful and resulted in patients dying. But again, they don't feel emotion anymore, so success! I call this an absolute win.
12.
Dr. Freeman's daughter jokingly called her father the Henry Ford of lobotomy. I'm not sure if his patients would find that funny, though. Probably because they can no longer feel emotions.
11.
Sigrid Hjertén, a legendary 20th century painter and major figure in Swedish modernism, was another victim of lobotomy. After she was diagnosed with schizophrenia, she was permanently hospitalized at Beckenberga Psychiatric Hospital in Stockholm, where she had a botched lobotomy and died of complications in 1948.
10.
Scandinavian hospitals lobotomized about 2.5 times as many people per capita as hospitals in the US. Sweden lobotomized at least 4,500 people between 1944 and 1966, with the majority of the patients being women.
9.
During the early 1940s, lobotomies began to be viewed as a miracle cure in Britain. It's estimated that British surgeons performed proportionately more lobotomies than the number done in the United States at that time. Way to go, Britain. Way to go.
8.
Warner Baxter, an Academy Award winner for Best Actor and the highest paid actor in Hollywood of his time, 1936, was one of the first famous victims of lobotomy. As he grew older, he suffered from arthritis and underwent a lobotomy procedure to ease his pain. Unfortunately, he died shortly after the surgery of pneumonia due to post-surgery complications.
7.
Rosemary Kennedy, President John F. Kennedy's sister, underwent a prefrontal lobotomy at age 23, which left her permanently incapacitated. Rosemary spent the next 6 decades hidden from the public in a Wisconsin Catholic institution where she was cared for by nuns.
6.
Her father scheduled a lobotomy without telling his wife because, in his eyes, Rosemary was mentally impaired and didn't fit in with the rest of the family.
5.
Ironically, when Rosemary died in 2005, she was the 5th of the Kennedy children to die, but the first to die of natural causes.
4.
During the mid-1950s, a new antipsychotic drug made lobotomies obsolete as a common practice. Its name was Thorazine.
3.
Thorazine was at first regarded as a chemical lobotomy. Although the results were not always conclusive, at least the person could simply stop taking the drug. A lobotomy, on the other hand, is irreversible.
2.
Despite the catastrophic side effects lobotomies had on their patients, Dr. Freeman would call a lobotomy successful if the patient was no longer agitated. Keep in mind that most of the patients who survived had to be retaught how to use the toilet and how to walk, but according to Dr. Freeman, that was just a minor detail. Maybe he needed a lobotomy.
1.
An excellent account of the effects of lobotomy and of the ethical implications of it as a procedure can be found in Ken Kesey's novel One Flew Over the Cuckoo's Nest, which was made into a film in 1975, for which Jack Nicholson won the Best Actor award. No, I don't have any. Have you ever had lobotomy? Let us know. No, I don't have a question for this one.
That's fine.
Thanks. So, let's hold a vote to see who we should give a lobotomy to.
Enjoying our lists? Be sure to click that subscribe button on the bottom right and the notification bell so you don't miss out on new ones every Monday through Friday. Share them with friends and help us consistently conciliate curiosity. And if you want even more lists, check out these videos here or just head to our website at list25.com.